Welcome to Oster Oncology. I'm Dr. David Oster. Today I'm going to be commenting on an article that was just released discussing some recent studies that indicate that patients using alternative medicine instead of their conventional treatments are actually harming themselves and actually decreasing their chance of overall survival. Stick around. Okay, so let's get into this article. I'm going to say a few things that throughout this video that may be a little controversial. My opinion is perhaps not the common opinion from my profession, my colleagues, but I really wanted to comment. I'm glad this article came out. It's been a video that I've been thinking about cutting for a while on different aspects of natural, complementary / alternative medicine used in the midst of cancer treatments for cancer patients. It's what I do. It's what I've been doing for the bulk of my career. And so I've been wanting, again, to comment on this theme. So I'm glad the article came out. It was authored by Erin Kayeta. She speaks with two medical doctors. One is a radiation oncologist out of Yale Medicine, and then the other is from the Utah School of Medicine. And both physicians speak to their experience clinically, and then also discussing two articles that have come out, 2018, 2019, that indicate that when patients are using alternative, and we'll try to tease out what that means, but alternative natural options instead of their conventional treatments, that it is actually harming them, that their overall survival is actually dropping by a significant margin. So the statistics are pretty clear that your survival benefit seems to decline when you decline conventional treatment and then also and turn to alternative medicine in lieu of. So the article's, it's pretty short. You can get into it pretty good. Both physicians and the author speak of the plethora of misinformation that's on the internet. So it talks about patients going on Google, listening to gurus that are out there in alternative medicine, and the misinformation, the exaggerated claims, especially when they're using the word cure. I always say this cure is an extremely special word, and to just flippantly use it for some program or something that you're selling out of a box and say, here's the cure, it's a red flag for you. It's a big red flag if you see that coming your way. But so they comment on this, and they highlight a couple things. I think they take some jabs at things like crystal therapy. But there's some other things that I've definitely seen in my practice. Essential oils are becoming more popular. There's certain diets that are becoming more popular, and then they really key in on probably the darling of naturopathic alternative cancer care. It's an IV therapy, IV vitamin C. I'm sure many of you that are listening to this video may be familiar with it. So they take a shot at IVC as well. And both of these doctors acknowledge that they're seeing a trend in their practices of an increased use of these and an increased rate of patients declining perhaps their entire conventional course of treatment or just a portion of it. So if you're having let's say a neoadjuvant chemotherapy followed by surgery and then some radiation, one of those pieces being dropped off. And there's a correlation that the patients that tend to make that decision are ones that are, when they're discussing what they're going to do, they're usually bringing forth to these physicians that they're turning to some other alternative treatment plan that they're going to be using instead of the recommended standards from conventional oncology. So they highlight a study, and again, it's pretty dramatic, the findings, and what it seems to indicate is that patients are making very poor decisions. And not to throw the baby out with the bathwater, but it does seem to say when patients, again, are moving away from their conventional treatments to alternative treatments, their overall survival is dropping. So my first reaction to this, and again, this probably wouldn't be the reaction from the bulk of my colleagues, but I agree wholeheartedly with, I'm not going to dispute the findings of the study, but I'm fully behind the conclusions that these docs are coming up with in the article, that patients are by and large making really poor decisions. They're turning to the latest alternative approach, strategy that has recent buzz to it, and following some gurus on the internet are pumping it up, and they're finding the truth about what they should be doing instead of conventional treatment, and the results are clear. It's actually harming their survival advantage when they could be doing conventional treatments instead. So again, I wouldn't be the norm on this with my colleagues, but I agree with it. I see it in my own practice too. So patients that come to see me, and in the hospital setting where I formerly worked, which was an integrative cancer hospital, so we did draw in and capture a greater percentage of patients that are wanting both conventional and the complementary natural at the same time. And so that's what I was doing there. And during that time, there were so many patients that when they came in with an interest, and I totally understand the desire to look in any area for anything that's valid that could help you in your fight. I totally understand it. In this article, actually, the doctors are really sensitive to that as well. They understand where the motivation's coming from. And so there's nothing to tisk patients at for that. Of course, if I was in any of my patients' shoes, I'd be looking for anything that I could to help me in my fight. So that's totally valid. The problem is, in my experience as well, it just echoes what I'm seeing in the article, is that when patients came to the hospital, when they see me in my private practice now, what I'm typically seeing is that they share with me a list of things they've already started to do, and I would say 80% of them are garbage. They're just hogwash. There are things that I know where they're coming from. I know where they're being promoted from, and so no fault to the patient. But when you look at the evidence to back up any of this, you come up with donuts. There's nothing there except some anecdotal reports, which I don't throw out. I love anecdotes. I love anecdotal reports of success. I love them in my own practice. I don't dismiss them outright. They actually perk my ears up, and then I go to the research and say, hey, is there anything to back that up? Like, that's amazing that they seem to report this helped that, and that's totally fine. Again, it piques my interest. But when we actually look at what guidelines we are going to follow that we think are going to help the majority of our patients coming in, and we are basing things on anecdotes that have no scientific backing behind it at all, it's certainly not how we practice. And so when we look at, again, when patients come in to see me, most of what I have to sift through are things that we, at the end of the day, we discard most of it, and then I'm putting in evidence-based, validated options instead of what they've turned to. So the studies that have come out, one came out in the Journal of the National Cancer Institute in 2018. The other one was in JAMA in the same year, 2018, in the Journal of the American Medical Association. And again, what it indicates is that patients that are looking for complements or alternatives, natural options to help them in their fight, are making poor choices. And they seem to be making a very defined line in the sand for themselves that I'm doing this, the alternative, instead of, I'm using it as an alternative to conventional treatment, as opposed to complementing and keeping anything on the table in regards to treatment options, anything on the table. Clearly, conventional medicine has proven itself, okay? It's totally validated. You know the survival benefit that a certain therapy will give you. If you walk through that treatment, you can hope to claim that survival advantage or that response advantage. Conventional medicine has all these guidelines. The NCCN guidelines are nothing but proven guidelines. So to discard and throw those off the table and then bring in wild cards instead that don't have any real data that we can turn to and hang our hat on and say, yeah, this is an alternative to that. If we don't have that data, we're passing over proven benefit for wild card question mark benefit, okay? And it seems to be, again, from these studies, that's what patients are generally doing. That's the behavior we see when they are turning to alternative therapies, okay? So it sounds like I'm sort of shooting myself in the foot here, because this is what my practice is. I'm using natural compounds and strategies to help patients with treatment so that they tolerate treatment better. I'm also bringing in natural compounds that do have evidence behind them that they are the best choices for an anti-cancer benefit, okay? And so it sounds like I may be shooting myself in the foot, but what I'm suggesting here, and what we'll get into a little bit more here, is that patients are making choices based on a lot of misinformation rather than the real good stuff. And they are approaching it as, I'm going to use this as an alternative and decline the conventional. A better model that I'm suggesting is that we actually use evidence-based natural compounds, and as long as they're done safely, we use them in conjunction with conventional medicine, okay? So naturopathic medicine should always be, I think always should be, at least in oncology, it should be conventional treatment affirming. And then we're in a fight here. Let's use anything on the table that we know can push back against this disease. And then if I can bring in anything else that's not in the convention, it's not in the conventional treatment, if I can bring these in, and as I'm discussing with your oncologist, that we're using them at the same time, then it's just money. It's an additive benefit, okay? And so this is a better model than turning to unfounded natural tools and discarding the conventional. Okay, so I think that should be pretty logical. That's the better approach. Okay, so the article is good. I agree with it. There's nothing here that got my hair on the back of my neck to stand up or bother me at all. It's just it grieves me a little bit because there is so much misinformation that is peddled to a very motivated, desperate, vulnerable patient population that's looking for anything. And if you've got a good salesman behind something, a lot of patients are being pulled into it. And especially when they're being told that the truth is that you don't need the conventional treatment. Just do what I'm doing instead. And we know that patients are being harmed from this. Not only that, we know that bank accounts are being stripped pretty clean from this too, because a lot of these alternative therapies, especially the most unfounded ones, are the ones that seem to incur the most cost to patients. So, my first reaction to the article is, I'm like, oh, I'm so glad that this is good. So often alternative medicine, especially complementary oncology, again, baby bathwater situation, sometimes we're bashed pretty good, but I think this was fair and grounded, and it's a good article, and it's something to really consider. Okay, so what I would be suggesting is when patients are considering these things, some red flags for you right off the top. One would be that if any practitioner you're working with is telling you that you don't need to listen to your oncologist and you don't need to follow through with conventional care. Red flag number one. Red flag number two is if you are seeing the use of the word cure, exaggerated claims, really exaggerated claims. They're telling you about an anecdote rather than telling you about the general experience they have in their practice, or if there's any validation in the literature, the published literature, to back things up. If it's exaggerated and you're not seeing any real solid science behind it, then you need to be careful too. Another piece to this is if they're not in communication with your conventional oncology team. So if they are not willing to write a letter to your oncologist and say, I saw your lovely patient, this is what I'm doing, this is what I suggested, I really encourage them to move forward with your care. And here is some literature to back up the things that I also suggested. If you have an issue with anything or a question, then you get back in touch with me. If they're not writing these letters to your oncologist, then again, another red flag for you, okay? So just some tips there as you're trying to weed through all of the melee of misinformation that you can find either in your own Google searches or if you go to a conference or something, or somebody's recommending something. Just always beware. And this is a major thing that I walk all of my patients through. In my initial consults, I'm often sifting through, and I really want to encourage them and say, I'm so glad the efforts and the motivation that I'm seeing in you to seek out anything to help you is so applaudable. It's beautiful, but then I'll walk them through and say, this one no, this one no, this one no, this one definitely not. But yeah, let's let me talk to you about these 3 or 4 other ones that I'm going to be using instead. Okay. Another tip as well would be, if you are wanting to look for someone specifically experienced in complementary integrative oncology, you look for a FABNO, FABNO, a fellow of the American Board of Naturopathic Oncology. So anywhere geographically you find yourself, you look for a FABNO. There is a bedrock, grounded guideline, evidence-based guidelines that FABNOs adhere to. You may still see a lot of FABNOs doing some different things as well that you may find questionable, but at least it's a good starting place. Go to someone who has those letters behind their name. They are based on a national standard of guidelines. Okay. All right. So I wanted to throw up just an example here, and I don't want to get myself in trouble, but I just wanted to bring up a website for you here. And this website is, I think it's like the most highly trafficked alternative medicine website ever. Like, this person's knocked it out of the park, doing very well for themselves, right? Okay, and so I think there's some good information on here, but when I pulled up this article, and I'm not going to say who the doctor is, but it's the top 10, what do they call it? The top 10 natural treatments revealed for you. It's like they're hidden, right? They're hidden from you, and these are the ones revealed, okay? There's a top 10 list here. The first 6 are hogwash. If you look for any type of evidence, published research behind any of these, they're common too, they're not a big shocker for me. The first couple are diets, which you may be familiar with. As I scroll down here, so this actually says the most effective natural cancer treatments, the most effective. It's a bold claim. If you say that, you need to back it up with clinical trials, or at least a huge amount of preclinical research. If you don't have it, then you can't make this claim. Okay. Again, working in conventional hospital for 5 years, the oncologists, amazing doctors I worked with, they've got their standards of practice. They have their first line therapy, their second, their third, their fourth. Why do they have them numbered in this way? Because they've been trialed with patients head to head versus each other to see which one comes through the most often. Okay? So number 1, we could say, is the most effective. You cannot just throw that up there and then put up some anecdotal buzz treatments that have a buzz behind them. And then patients are reading this. Patients are taking this, especially off a website that is so highly trafficked and respected. You get conferences like this too that throw up a bunch of this stuff. And if you look, which I have, if you look for published research, go on PubMed and go see if you can pull up research for Gerson therapy, juicing, and coffee enemas, and see what you get in terms of published evidence, okay? And it's been around forever. If there isn't anything published, shame on those that are practicing it, because you should publish your work. If you are saving most effectively, if this is your most effective treatment, it's a shame that you're not publishing it for the rest of us actually to see it and say, oh my goodness, it is legitimate. I'm going to be using it with my patients. If you want to help as many patients as you can, you need to publish your work, okay? So there's some diets here. Number 2, I'm going to skip another diet. Number 3, proteolytic enzymes. This comes from Dr. Nicholas Gonzalez, and I'm familiar with what he's been doing, and I think he's published some benefit to patients, but it's not just proteolytic enzymes, which a lot of patients come in and they're just taking proteolytic pancreatic enzymes and think this is going to fight against our cancer. The Gonzalez protocol is far more elaborate than that. And then we're on to number 4, which is IV therapy. And IV therapy has to be the most adhered to, most commonly promoted in clinics of colleagues of mine. And this is where I can get a little controversial, and I'm not seeking out to throw colleagues under the bus. I'm not here. But if I have an allegiance to anybody, it's my patients, and it's to a listener that's just been diagnosed. I have a greater allegiance to you than I do to any colleague. I love my colleagues, but my allegiance is to you. And I do have colleagues that use IV vitamin C. I want to respect them on that. I know some use it very appropriately at certain times. But the common use of intravenous vitamin C is across the board, every cancer patient. You go to conferences, oncology conferences I go to, and when they hear I'm not hooking everybody up to IV vitamin C, you can just see the bewilderment on their eyes. Like, that's the bedrock, that's the cornerstone core of most natural alternative treatments, okay, by far. I actually, a couple years ago, I was inquiring of a clinic. They were looking for employment, actually, opportunity, and I was thinking of maybe joining and coming alongside a clinic on the Upper West Coast of the U.S. And at the time, we were discussing their practice model, and I was sharing them mine and my experience from, again, the hospital. And it was a shock to me that the owner of the clinic, not even if he didn't even treat oncology, so he's not experienced in oncology, was speaking to me. And I'm no guru, but I'm no rookie either. And he was speaking to me about how I need to be, everybody gets IBC that comes through our door with cancer in our clinic. And I said, really? And he was like, absolutely. And he actually said, this is our business model. Okay? So again, another buyer beware here for patients. IBC, if you look at intravenous vitamin C, you may hear that it's got some evidence behind it. Again, it's pretty much donuts. There are therapies, there are natural therapies that there's an anecdote, there's a study here and there, and you look for research and it just hasn't really been studied well. And so I'm thinking, you think, well, maybe down the road this will be validated. Maybe it's actually a really good therapy that could fight back against tumor growth. That's not the case with intravenous vitamin C. It has been trialed. Maybe it's not the most, but it is in the top of the list. It's been trialed with patients that have tumors that are undergoing active disease at least a dozen times, and it has never been shown to impact tumor growth. Okay? So we have a therapy that has been trialed numerous times, coming up that it's failing with its ultimate endpoint of, it's not even close to a cure, but it's not even getting response rates from tumors, an improved response rate. And yet, the vast body of my profession that is treating cancer have IV rooms, everyone's hooked up, and everyone's being given intravenous vitamin C. Okay? I'm past tiptoeing through this, but it's always been a concern for me ethically with our profession. I think there's other motives behind the IBC bit. I've had patients, many patients, when I'm not doing IVC, co-treat to a clinic where they have had IVC. So many patients that I've seen that have had intravenous vitamin C, and I have never seen it win the day. I have colleagues of mine that have been doing this for decades, just oncology, naturopathic oncology, and they would concur they've never seen intravenous vitamin C cure. And yet, when patients come in, everyone knows of this, it's the sexy therapy, right? You infuse it in, it seems like you're really cooking with gas, and it is a shame when a patient comes in saying, hey, I want to fight this, I want IV vitamin C, and a colleague of mine, let's say, when we as a profession know that there's not solid evidence, and yet we still say, okay, and we hook them up. It's unethical. And especially when the therapy is very time consuming, you're in multiple times a week to that clinic. And it's also very questionable as well when it's a very lucrative therapy to have in your clinic, running IVs all day long. It's again, I have greater allegiance to you, my patients, and to you that are thinking about this. By really be concerned when you see these types of therapies promoted that do not have any backing behind them. You look up IVC, there's a little bit of published evidence, but the main black mark against it, it has been trialed in patients numerous times with no impact on survival, no impact on tumor response, and physicians that are using this therapy never mention that to patients. Okay. Number 5 is frankincense oil, so essential oils. It's really popular. I'm not going to get too much into it again. Look for research. Finally, number 7 out of the list. Gone through 6, none of them have good evidence. Number 7, he talks about vitamin D on the website. And there's really good evidence for vitamin D. There's correlations with breast cancer, prostate cancer, pancreatic cancer, colorectal cancer. Vitamin D is this beautiful little vitamin that it does have anti-cancer potential in it, especially if you get your blood levels up. They should be checked every year. Make sure your vitamin D levels are strong. Finally, number 7 on the list after we've gone through 6. Number 8 is turmeric. It should have been at the top of the list. So finally, we're getting into something that has some evidence. I don't know if there's another natural compound that has the most preclinical research. Anywhere across the board where you study turmeric, cell studies, across the board it never fails. Xenograft, preclinical models in animals, wealth of research, again and again, never failing, always showing some ability to sabotage tumor growth in very specific ways, looking at the genetics and the molecular machinery of how cancer grows. Turmeric's beautiful. There's a specific form that I would encourage you to use. So there's a lot of bad forms of turmeric out there that probably are a waste of your time. But finally, number 7, number 8 on the list. Number 9, we're getting into oxygen therapy. Look for research there. Prayer as well. And he quotes some scripture here, and I'm all for prayer. I truly am. But again, when you are putting this on your list of the most effective anti-cancer natural compounds, there's others that should be on here instead of this. There's a bonus therapy here thrown in at the bottom, and it's medicinal mushrooms. Mushrooms are beautiful, especially the one they list here, very appropriately. Actually, I just read this a second time. It says cordyceps here is a lovely mushroom, but it's not the one that should be actually listed here. The mushroom that has the most clinical research with patients is a mushroom called Coriolis, which is turkey tail, Coriolis versicolor. And if anybody put up a list like this, or on a reputable website, and they are giving their top 10 countdown, number 1 on the list should have been Coriolis. Okay, number 2 probably turmeric. All right. When we are basing this on actual evidence, Coriolis, just like IVC, has been trialed over a dozen times in patients. Coriolis shows overall survival benefit. Coriolis shows improved tumor response to conventional treatment. IVC, it doesn't at all. And so it is a concern when you walk into a clinic and when you see IVs being pushed on patients, and the top 2, which I mentioned, but there are others, the top 5 natural compounds that have the greatest research going for them are absent. It's a peculiar omission when you see therapies that should be if you want to do IVC and essential oils in your practice and you want to do that as a patient, that's fine. But it's a peculiar thing when you see an omission that the core bedrock of the most validated, and there's some good validation of these tools, the top 5 or 6 tools that should be on this list are not even mentioned. They're not mentioned on this list, and you also don't see it in protocols developed by colleagues. And I start scratching my head saying, where are they pulling their treatment plans in from? How are these decisions being made if it's not based on evidence? 20 years ago, you could have heard, especially from conventional medicine, there's no evidence for any of this stuff. Okay, that is an outdated notion. It just betrays someone's lack of reading the published evidence. We are in a day where there is a wealth of research that you can stratify into top tier tools, some good thoughts to maybe add in, and then tools and strategies that have been tested that are bankrupt when it comes to any evidence supporting them. And so again, hopefully I'm not in too much hot water. I'll close that site. And but back to the article, it is a valid concern that conventional medicine has, and hopefully what practitioners, again, look for a FABNO, hopefully you can find doctors, naturopathic doctors in your area that are filling in this gap between conventional medicine only and over here alternative misinformation. That is a bad decision. You are going to not reap the hoped expectations that you have from a lot of this natural hogwash that's being promoted out there, okay? And so in between, you see, rightly so, conventional docs looking across this gap and saying this is awful, alternative medicine is a joke, we should combat it, quote unquote, the name of this article. And hopefully you can find a naturopathic doctor that stands in this gap and can look both ways and say, yeah, the conventional medicine is going to help you this way, and that way. I affirm it. I'm going to interact with your oncologists and make sure that they know that everything that we're doing, and there's a trust built there. I'm going to make sure everything's done safely in conjunction with your conventional treatments if we're introducing anything natural. And then also looking across the gap this other way and being able to say, don't do it, there's nothing to it, it's profiteering, it's misinformation, you're going to be having a lot of wasted time, a lot of wasted money. And to have a doctor that can formulate something that is a beautiful, appropriate, evidence-based, best approach so that you can fight stronger and fight smarter. If you have any questions on what I covered here today, I don't anticipate everyone agreeing with my point of view, but if you have any questions on this, please comment below if whatever social media interface you're reading this off of. Fire me some comments. I'll try to get back to you as best as I can. And certainly open to any other follow-up videos. If you have any ideas on, can you comment specifically more on the research of IV vitamin C? Can you comment more on the research and walk me through what Tumeric has to boast of? Can I walk you through any of these things? Throw me some ideas on some other videos. I'd love to, again, share with you evidence-based encouragement, because hopefully this isn't a downer. There are alternative natural compounds that have a very valid reason to be looked at for an anti-cancer approach. And I want to, again, let you know they exist, but unfortunately patients are not being made aware of the top-tier evidence-based tools. And I almost feel like these conventional docs, the conventional docs radiation oncologist is saying these tools, we know they help patients in overall survival and tumor response, but they're declining them for silliness. And I sort of have a very similar feeling as they do, in that there is evidence-based, really good, valid alternative medicines, and you'll understand the proper expectation you can have for them. You can be encouraged by them. You can dive right into them. They won't break your bank account either. But again, I feel the same way. I'm looking over and I'm like, there's too much misinformation and hogwash being peddled, and patients are choosing that instead of the real deal. But hopefully get the video out. If you want to share this with anyone or like it, please do. And again, any comments, any further follow-up video ideas that you have for me, please throw them my way. You can reach us, of course, at osteroncology.com, and our contact information I'll leave at the bottom of this site. So again, this is for more information for you to fight stronger and fight smarter. This is Dr. David Oster from Oster Oncology. Thank you.